Thank you, Eddie, and thank you, Sue, for the invitation to this wonderful, wonderful evening and your amazing organization. So I'm going to just talk about South Africa and funding issues around cochlear implantation. So we've spoken a lot about most of these issues. It's really good to hear the emphasis on the rehabilitation. That's really one of the biggest challenges. We know that the cochlear implant device is expensive, but we also know that good outcomes have very significant cost savings in the long run. So we have 5 certified AV therapists in South Africa. We're very fortunate. And the outreach is really something that is a challenge because we have a lot of rural patients as well. In setting up a cochlear implant program, it's essential to think about the lifelong sustainability of that program. We started our program in 1986 with Lida Müller and Derek Wachenfeld. So we've been going for 38 years, which it is a lifetime. But something that's been really important in our program and in outcomes is one of the things is having the audiologists have to map cochlear implants in South Africa. They have to do an additional training course. It's a 3-week intensive course. So the need for accurate mapping is fundamental to good outcomes, because if a child doesn't hear properly, they're not going to learn to speak properly either. Over the years, we were the first program in South Africa, and over the years, we've now got 13 teams spread across the country, mainly in the rural and in the urban centers, the main urban centers. If you can advance, click. Just go back. So each, just go back one click. Each of these areas on the slide are all areas where attention needs to be given. The services, the device, the maintenance of the device, the infrastructure of the program, as well as the rehabilitation centers, funding and recognition of each of these is critical. And all of these require passionate and dedicated attention, and not just attention, but action from the health care professionals, as well as from advocates or the cochlear implant users and parents themselves. Okay. So this is a rather dark picture of us in South Africa. We have a lot of challenges. I'm sure you're all aware of that. We have huge levels of poverty. 26% of our population live in extreme poverty, and almost half of our population rely on social grants. We also have one of the highest unemployment rates in the world, and particularly high, 60.8% in the youth. And crime ranks first in Africa. So we also have a problem of people's processes being stolen. So we have lots to think about when we look at funding of cochlear implants. In addition to those challenges, we have a healthcare system that is a 2-tiered health system. We have state or public funded healthcare, and then the private sector. And 27% of our population is looked after by the private sector, and the rest falls under the state sector. So you can see the challenges that there are. In terms of health expenditure, the highest expenditure in the healthcare system is on TB and HIV. We have the highest HIV rate in the world, and 70% of our population are on ARVs. So looking at how money is spent within the healthcare sector, one has to look at it against the backdrop of that. And one can understand the challenges that exist. Okay. So as far as cochlear implants goes, the majority of funding for cochlear implants comes out of the private healthcare sector. There are different medical aid schemes that give different levels of cover, some excellent and some less excellent. And over the years, it has improved hugely, but it's taken a lot of work and a lot of engagement with the decision makers within these medical insurance schemes. However, the rehabilitation and paying for parts is a challenge because a lot of them don't cover that nearly enough. So it's limited rehabilitation cover because, as Paige said earlier, it's not a 1-year therapy process. It takes time. It takes sometimes years. In the state sector, there are varied levels of support that we have in South Africa. In 6 of the 13 programs also services the public sector. Some of these only pay for a cochlear implant device. A few of them pay for the cochlear implant device and a limited number of upgrades to new processors, and some also cover the long-term maintenance of the device. So there are varying levels of care. We look a lot to charity organizations and foundations, and there are quite a few that really make a difference and help. But you can see the one picture is our charity for our program called Hear Us, where we had cochlear implant users that did the Robben Island swim across freezing cold water to do a fundraiser for cochlear implants for our program. And then we also have the Two Oceans Marathon, where we have healthcare professionals, members of the public, and as well as a lot of the cochlear implant users themselves running to raise money for our program. Okay. So this is an audit that was done by Akila Bamji from Pretoria University in 2021, and it's just quite a nice way to look at how the funding has been allocated over from 1986 to 2019. And as you can see, less than a quarter of the patients implanted in South Africa were state funded. Okay. So these problems have meant that from the beginning, when our program was established, other than the normal common criteria for consideration of candidacy for cochlear implant, we have to look at some other factors as well. You can advance the slide. So for adults, we also look at their skill or desire to enable re-entry into the workforce. And they need to be able to access services. So it doesn't help have your implant and then you can't get back for all the post-op care. So that is one of the factors that we do look at in candidacy. Children, the age in our program, we would like to implant below the age of 3. Older children don't have such good outcomes, and we've got to look at the most cost-effective, responsible use of the limited resources that we have. We also would like their parents to be employed or somebody supporting the family so that they're able to various levels, at least support the long-term maintenance of the costs of their device. So the ability of the patients to financially maintain their device are important considerations. So since 1986, about 4,000 people have received cochlear implants, but sounds a lot. We have a population of 64 million and 4 million deaf people in South Africa, of which 600,000 are South African Sign Language users. So we're hopelessly under meeting the need. Okay. So our biggest challenges for funding, just to summarize, is the allocation of healthcare resources, unemployment and poverty, and what's been said a lot throughout this presentation is government level awareness and prioritization of hearing healthcare, including newborn hearing screening. There are pockets of newborn hearing screening happening, but it's not national, it's not being put into law. So our challenge is keeping patients on the air, especially our state patients. So if cable breaks, where are we going to get another cable? We rely a lot on patients who have upgrades through the private sector to then donate all the parts of their existing processes so that we can recycle them. And we work very hard. There are lots of real people putting a lot of work into ongoing communication to funders about the cost effectiveness and the wonderful CIICA saying of we spend to save. I love that, and we use that a lot so that we end up with fewer people landing up on social grant systems, higher unemployment. In other words, they become taxpayers instead of recipients of grants, and improved educational levels. Okay. Can you advance the slide? Okay, so we've had at two of our national conferences, our South African Cochlear Implant Group, we invited private and state funders to attend the conferences, and we had sessions on funding and cost effectiveness, and it's been a very effective way of spreading the word. And we've seen that it's resulted in increased allocation of funds. Our program also puts out an annual newsletter that gets sent to all potential funders, and lots of radio interviews and trying to raise awareness. It's important way to make more awareness about deafness. So World Hearing Day, World Cochlear Implant Day, those sorts of things. We really run campaigns to try and raise awareness. Okay, in advance. But is hearing or access to sound not a basic human right? And we have an amazing constitution in South Africa that came in when the end of the apartheid government happened, and very protecting about human rights. And really, I think that this is the main drive, is hearing not a basic human right. Next slide. And this, just to end with, has been probably the biggest achievement in the country of raising awareness about deafness and cochlear implants in South Africa. Our Miss South Africa pageant, beauty pageant, I'm not a great supporter of beauty pageants, but this time I definitely was, is a cochlear implant recipient. And she's been amazing. And I just want to read some of the quotes that she has said. As a deaf woman, she was implanted when she was 2 years old. As a deaf woman with a cochlear implant, I represent a community that often goes unheard. I am here to prove that, despite being differently abled, it has not affected me in terms of what I am capable of. I aspire to eventually help provide cochlear implants to those who cannot afford it and give the same gift my community has given me, and to teach the included how to be inclusive towards the excluded. Thank you.